Hello. Today we have a 27-year-old female patient with a history of bilateral complete cleft lip, cleft palate, and cleft alveolus. She was operated earlier for 11 times to correct her lip and palate. There was no alveolar bone grafting done, and the premaxilla is very hypoplastic. She is having a cleft maxillary hypoplasia, so that means she has a underbite along with backwardly placed upper jaw. So this is a very common problem in cleft patient. Almost 40 to 60% patient with a complete cleft lip and cleft palate ends up with cleft maxillary hypoplasia. So at our center, we follow different treatment based on their age. If the patient is coming at early age around 7 to 10 years, that time if we find patient is developing cleft maxillary hypoplasia, we go for the BAMP, bone anchored maxillary protection. Usually we try to combine BAMP treatment with alveolar bone grafting surgery. So in this process we take advantage of patient's growing face. So during the alveolar bone grafting we place 2 plates on the zygomatic cheekbone area and 2 plates over the chin area, and after that we start with elastic traction. So the elastic will pull maxilla forward and the mandible backward. So during the growth time, this reciprocating forces go on the jaw, and it tries to it favors the growth of maxilla and restrict the growth of mandible. We continue this elastic process for up to the age of 15 years. A patient is reporting at the later date around 12-13 when all the permanent teeth are erupted, or any later date, and if we find crowding in their teeth, if their speech is normal, we generally prefer to do anterior maxillary distraction. So in anterior maxillary distraction we put the screw in the palate, and that is added to the teeth with the bands. So the bands are put on the molars and the premolar, and after that we do AMD surgery. So in that we give cut between the first molar and the second premolar, and we release the anterior maxilla, and after 5 days we activate the screw. So slowly upper jaw, front part of the upper jaw come forward. So the advantage are it doesn't disturb the speech, plus we get additional gum or alveolar bone for good alignment of the teeth. If patient is reporting us at the later date, or sometimes if patient's arch is normal, then we do corrective jaw surgery at the age of 14 to 16. If you want to know more about corrective jaw surgery, we have a video. Here is the link. You can see the link and you can get more details on the corrective jaw surgery.